self-care, self-determination, and person-centered care in regard to healthy aging. The objectives for this lesson are to define self-determination and person-centered care, and identify the principles of person-centered care. Then to list the attributes of person-centered care and examine what prevents it. To define what we're talking about, self-care is the practice of taking action to preserve or improve one's own health, whereas self-determination is each person's ability to make choices and manage their own life. And person-centered care is providing care that is respectful of needs and values, cultural traditions, personal preference, family situation, social circumstance, lifestyle, and needs, ensuring the person guides decisions. So what about self-care? It drives the person's ability to be independent. Due to normal aging process, a person's ability to carry out self-care through the end of life is often compromised. Thus, self-determination and person-centered care become important to carrying out a person's wishes. So, what is self-determination and how is it implemented? A person's self-determination drives the person-centered care, allowing them to lead and make all decisions about how they live their life. Institute for Healthcare Improvement says putting the person at the heart of every decision and empowering the person to be genuine partners in their care is what's needed. It shifts the conversation from what's the matter to what matters to you. As you can see just from that statement, that will promote healthy aging. New ways to make person-centered care effective is to developing a person-centered service plan that's co-designed with the person and their caregivers, ensuring that an individual's care preferences are understood and honored, and collaborating with partners on programs designed to improve engagement, promote shared decision-making, and provide compassionate and empathetic care. So exactly what is person-centered care? The overarching goal of person-centered care is health advocacy. Advocacy is the act of arguing in favor of something such as a cause or idea, whereas health advocacy encompasses direct service to the individual or family, as well as activities that promote health and access to health care in communities and the larger public. And a healthcare advocate is the person, family member, caregiver, or clinician who supports and promotes the right of a person in the healthcare setting, focuses on availability, safety, and quality of care, and uses self-determination by providing an informing choice to guide a person-centered care plan. It helps to build capacity in a setting, system, or policy, and can address the complexities of healthcare. So the elements of person-centered care are whole person care, coordination and communication, support and empowerment, ready access, and autonomy. Here are the principles: respect for preference, coordination and integration, information and education, physical comfort, emotional support, involvement of family and friends, continuity and transition, and access to care. In regard to respect, it's for values, preferences, and needs. It's involved in decision-making, recognized as an individual with their own unique values and preferences at all times, so that all are treated with dignity and respect and sensitivity to cultural values and autonomy. Coordination and integration is that people are expressing feelings vulnerable and powerless in the face of illness. This is common, particularly when aging. And proper coordination of care can alleviate these feelings. Areas in which care coordination can reduce feelings of vulnerability include coordination of clinical care and coordination of ancillary and support services. Information and education are also important. People express worries that they're not being completely informed about their prognosis. To counter fear, clinicians can focus on providing 3 types of communication: information on clinical status, progress, and prognosis, on processes of care, and to facilitate autonomy, self-care, and health promotion. This is what healthy aging adults seek. Physical comfort is also important. The level of physical comfort people report has a significant impact on their experience as they're aging. Areas of particular importance are pain management, assistance with activities of daily living, and their surroundings and environment. Emotional support is also important. Fear and anxiety associated with illness can be as debilitating as the physical effects. Clinicians should pay attention to anxiety and depression regarding physical status, treatment, and prognosis, the impact of the illness on the individuals and their families, and the financial impact of illnesses. Involvement in family and friends is key. It's a dimension of care. You need to involve family and close friends in caregiving, decision-making, and providing accommodations, supporting each other, and recognizing the needs of those involved. Continuity in transitions is also important because as adults age, they transition across many different healthcare settings. People express concern about ability to care for themselves after discharge from hospital and to meet needs, and they require the following: understandable, detailed information regarding medications, physical limitations, and dietary needs, coordinating and planning of ongoing treatment and services, and providing information regarding access to clinical, social, physical, and financial support on a continuing basis. This is true when someone comes out of the hospital or they go from the hospital to a nursing home. Continuity of care and among those where settings of transition are very important to healthy aging. Access to care is also key. People need to know they can access care when it's needed. Hospitals, clinics, and physicians. They need transportation to get there. They need to easily be able to schedule appointments and have them when they need them. And accessibility needs to be available, like if they have difficulty hearing or are deaf, they need sign language, or if they have a wheelchair, they need to be able to get into the building. And they always need clear instructions on when and how to get referrals if other services are needed. Healthcare access is key to person-centered care. The approach to person-centered care is that there's respect with the uniqueness of the individual, which does create an environment that promotes personal worth, social confidence, respect, truthfulness, independence, engagement, and hope. Person-centered care works. All adults who are aging in a healthy manner need person-centered care. It promotes choice, purpose, and meaning in daily life. It supports achieving the level of physical, mental, and psychosocial well-being that is individually practical. As we age, we can't all do what we've always done. It also honors the importance of keeping the person at the center of the care planning and decision-making process. No one likes others to make decisions for them. And care plans are living documents that are revised to reflect changing needs. We need to place a premium on active listening and observing so that individuals can adapt to their changing needs as they're aging so that they can have the optimal quality of life possible. So think about it. How does person-centered care benefit a person who's aging? They have autonomy. They're able to direct their care and services. They can be engaged. It improves their quality of life, and it develops an environment of trust and respect. The usual medical model is this. The person's role is passive and the recipient of treatment, and they don't do the plan. Clinicians dominate the conversation and do not interact with the person. Care is disease-centered and often by condition with multiple physicians. Clinicians direct care and do most of the talking, and the person may or may not adhere to the treatment regimen or plan. But when there's person-centered care, the person's role is active, and they're a partner in the treatment plan and care. Clinicians collaborate with the person, offer options, discuss pros and cons, and care is focused on quality of life and the desires and needs of the individual. Clinicians listen more and talk less, and the person is more likely to adhere to a treatment regimen or a plan. In summary, person-centered care fosters optimal care driven by the person receiving the care rather than by clinicians or an organization giving care. It empowers a person with the core values of choice, dignity, respect, self-determination, and a purposeful life, which is important as adults are aging and choose to live as healthy of a life as possible. Thank you.